Hey, ASD Shine Bright. My name is Vanessa Wynn from Service High School. I'm the president of the Biomedical Career Academy and Women's Club, and I'm here with the State Medical Officer for the state of Alaska, Dr. Zink.
Yeah, it's great to be here, Vanessa. Thanks so much for having me.
Thanks for taking time out of your day. You're very busy. So what do you do as a State Medical Officer?
Yeah, so that's a great question. So in my role, I work within the Department of Health as in the Commissioner's office. And so basically my role is to kind of be a patient voice as well as a provider voice across the state. So it may be everything from thinking about the rising rates of syphilis and how we can make sure that young people are educated about the disease and make sure they're getting tested and treated and healthcare providers know, to making sure we've got enough supplies, to thinking about the ways what Medicaid is paying for to improve blood pressure control or diabetes control. So it really depends. Every day is different. But what I love about the department is the mission, which is the health, well-being, and self-sufficiency of Alaskans. So every day, my job is a little bit different, but it's really to meet that mission, and it's an amazing job.
That sounds really fun.
It is fun, actually.
How did you get here?
That's a great question. Yeah. I would have never expected to be here. So I grew up in Colorado. I went to college on the East Coast. I went to med school on the West Coast. When I went to college, as well as med school, I went to Stanford, and it was very kind of subspecialized. And I realized that I missed knowing patients in their larger community and larger environment. So I ended up working and going to my residency at the University of Utah. But during college, med school, and then residency, I came up to Alaska during the summers, and I was a mountaineering guide. And I totally fell in love with Alaska and the place and the people. And so after residency, I moved up here. I thought I'd be here for like 2 years. I was really interested in system work and trying to kind of create better systems of health. And Alaska usually isn't on people's like #1 bucket list of like thinking about large systems of health. But it was a great place to live and play. And what I really realized is it was a great way to work with people from all sorts of different communities, being able to work with public safety to congresswomen to, law enforcement, all sorts of different teams to think about what makes healthcare better and patients' lives better. So I started to figure out ways that I could try to make the system better. I realized that all good public policy comes to fail in the emergency department, and that I was going to burn out if I didn't figure out ways to make systems better for patients. And that really started with opioids. Seeing how many people were accidentally overdosing was just tragic. We still have really high numbers of opioid overdose. And became much more involved in that process, started to become involved in state and federal legislation. Got to know my predecessor, Dr. Jay Butler, and I always loved how he was hard on the issues but kind on the people. And I had told him someday, I'm interested in being like you. And I didn't think that someday would happen, but in January of 2019, he called. He was moving to a different role, and I stepped into this role in July of 2019, 6 months prior to kind of COVID, and have been in it for almost 5 years now. And it's been honestly the opportunity of a lifetime. It's been amazing. It's kind of incredible when you put your heart and soul into really serving patients and putting your community first, but then also verbalizing where you want to go, how much of the world sometimes comes around to make those opportunities happen.
That's great.
Yeah.
That's great.
Cool.
That's a long journey.
It's been a long journey.
Yeah. So as the Chief Medical Officer for Alaska, during COVID, what was that like? Was it especially crazy during those times, or?
Yeah, it's interesting to look back. I think that it's easy to forget how much has changed, in today's world and where we're at now. I saw my role as the Chief Medical Officer very similar to my role in the emergency department. In the emergency department, I'm not the cardiologist. I'm not the patient's primary care doctor. I'm not the patient's family. But what I am is there to serve the patient in that moment and bring those resources together to stabilize and to help serve the patient. And honestly, COVID was the same. We didn't have testing. We didn't have vaccines. We didn't know very much about the virus. There was a lot of conversation. And my job was not to be the epidemiologist. It wasn't to be the governor. It wasn't to be the tribal leader. It wasn't to be the school principal. It was to try to provide information and resources and to coordinate that space so that we could have as much health and well-being as we possibly could within the state. And so it was a very similar role. It was a crazy time, I think, for all of us in different ways. As a practicing emergency physician, it was scary to see how sick patients could come in. And I think those who lost someone to it or saw it up close saw how bad it could be. But it was also fascinating how mild it could be for other people. So I think that dichotomy of how different the disease could be was really hard for people to understand. and the way the virus has changed, and we're at just such a different place. But it was an honor to serve during that time. I really hope that Alaska will be able to see that time as a time of great resilience, because what I saw in my role was students and principals and tribal leaders and municipal leaders and seafood fishermen and lab technicians and healthcare workers come to the challenge of supporting each other and supporting the community. We were predicted to be one of the hardest hit states in the entire country, if not the world. And past epidemics and pandemics, including the 1918, really hit Alaska disproportionately hard. Mm-hmm. But what came out wasn't that we did much better than most other states. And that was because of Alaskans working together to find solutions together.
Yeah, kind of seems like we all learned and grew together.
We did. So, we grew together. There was so much to learn.
Yeah.
And I think sometimes we forget how much we've learned. And let's keep that going. Let's keep the learning and the partnership and the collaboration going, because we have a lot more things to do to be healthy and well in the state.
Exactly. And on that note, am I allowed to bring up?
Bring up whatever you want.
So,
go for it.
So for learning and growing, how do you think going back to you're going back to becoming full-time a emergency?
Yeah, I'm not going to actually go back full time. So it's a great question. What am I doing next?
Yes, what are you doing next?
What am I doing next? So, I think every time we have an opportunity to serve, and I've been in this role for about 5 years, and I just feel like the team is thriving, they're growing. I sometimes feel like Dumbo's feather, I feel like they can fly without me, and I am here to encourage them, but it's time for them to fly, and it's time for me to align my skill sets and my interest in other areas. I'm Alaskan, I'm gonna stay here. I'm still working my 6 shifts in the emergency department, but I'm really interested in thinking about how we can make systems better work for patients instead of asking patients to take on the burden of broken systems. And so I am gonna take some time with my kiddos this summer. As I mentioned to you earlier, I've got one daughter going off to college like you, and another daughter who is a sophomore in high school. She'll be a junior next year. So I'm gonna spend the summer with them, and then really looking to do some of that health policy work come this fall while still serving in the emergency department.
That's great.
Yeah.
So you said about your daughter going off to medical school. I actually don't have any family members that have gone off to medical school that live in the state of Alaska with me. Is there any advice that you'd give to someone who is trying to go along that path into med school and then residency?
Yeah, it's a great question. So my daughter's actually going to college, and I don't think she's going to go to med school ever. I think she's that is not she's very interested in architecture and other things, which I think is great. But, I grew up the daughter of 2 physicians, and I said I would never become a doctor. I wanted to have more cupcakes that my parents would bring to school, and I wanted them to be around more than they were. They're great parents, but I didn't think that was the place that I wanted to be. I was an inorganic chemistry major in college and a fine arts minor. But what I kept finding is that I was really drawn to the intersection between science and human experience. And even in my art and inorganic chemistry, it was how do you express something and how do you understand the why behind it? And medicine just embodies that for me. It's trying to understand the why, but also the human experience as a part of it. And so I realized that I loved medicine and I wanted to follow this direction. And so I tell people that it is a job, but it is an incredible privilege. It's just, when I work in the emergency department, it's like I get to hear, 30 different short stories each day. When I pull back that curtain, they haven't ever met me before. They are oftentimes in a gown, hooked up to monitors, having the worst day of their life, and they share with me their fears and their concerns. And it's such an honor and a privilege to be able to walk through with them. Is that chest pain a heart attack? Is that fever going to cause a seizure? Why will their leg not move? Whatever the issue is. And so if you're really drawn to it and that is the space that you love, don't be intimidated by med school and residency and MCATs and all of the other things. Do what you love and the rest will be easy.
That's great. Yeah. That's great. Thanks for that advice.
Yeah, you got it. If that's what you're interested in, shadow, learn. The best single piece of advice I got during residency was a great attending who said to me, do what's right for the patient and remember that the rest is noise. And that has been kind of my professional guiding mantra since then. And so if you love serving patients, there's a lot of noise in medicine, but there's a huge opportunity. It's a huge gift.
Yeah, I agree with that.
Yeah.
So you said you went to college, you went to undergrad on the East Coast and med school on the West Coast.
Yeah.
How did that compare?
Oh, good question. They were really different for sure. You know, I grew up in Colorado and everyone seemed to be going to college on the East Coast, and I just thought that's what you should do. And it was a great experience. I think that nature and land make a big difference for me. I love just being in the mountains. I love being able to go for a long run. I felt somewhat claustrophobic, honestly, on the East Coast. Like, I'd find myself climbing the stairs to bell towers so I could like get a view. But I had a great education and learning experience. But I realized in that process that being the places that made me happy and doing the things I loved was more important than any name or any specific school or any expectation of what I should or shouldn't do. And so I started to prioritize that more for both med school, residency, and then my job afterwards. I think it took me maybe longer than it took other people to figure out what my priorities were and making sure that I was aligning my time and effort with my priorities and not allowing other people's expectations to influence that. But there's a great joy that comes from being able to align your time and effort with your priorities. And that's part of the reason I went to college med school on the West Coast. And it was very different. It was a lot more swimming outside and biking and running than there was on the East Coast. They were both great schools, but just a really different kind of cultural feel.
So I have one last question. Or it's kind of two questions together. So I like to ask, during my college interviews, I asked all my people this, what is your least favorite part of your job right now? And then on the flip side of that, what is your favorite part or like your favorite product that you've worked on so far?
So I really love that you ask what is your least favorite, because when I was trying to decide what specialty I was going to go into, I was really drawn to surgery. I love the beauty of surgery. And I had an attending once tell me, figure out what's the worst part of a job and figure out if you're okay with that. And then you'll be fine with whatever happens. And in emergency medicine, a lot of people get frustrated with people who are struggling with addiction or alcohol or mental health. But honestly, I just find it such a privilege to care for people regardless of who they are, what walk of life, what their trauma or struggle is at that moment, that didn't seem like a hardship in the job in that space. And so that question is what led me to go into emergency medicine, figuring out what was the worst part of the job and what did I love, and being able to move forward. I think right now, the worst part of the job as the chief medical officer is there's a lot of reasons that systems have been set up the way that they are, but it's hard for those systems to keep patients and providers at the center of what they do. And a lot of my time and effort has been spent trying to really align systems to be human-centric, to making sure that policies are really serving patients. And there's a lot of history and bureaucracy where that hasn't always happened. And it's a lot of cultural change, it's a lot of systemic change. So I think that's probably the most frustrating part of the job. I think the thing I love the most about the job, I mean, man, it's an amazing job, is the mission of I get to work across all these different departments, divisions, with people across Alaska, trying to find ways to make systems work for people and making that mission happen, the health, well-being, and self-sufficiency of every Alaskan. And then honestly, it's the little things like conversations with you and talking to the mayor of Cordova, or going for a walk with a tribal leader in Utqiagvik. Like those human connections and stories is what makes the job the best. So I really appreciate you taking the time to interview, because these are the fun parts of my job.
Well, thank you for so much of everything that you do. Thank you for putting the people first and giving me your time.
Yeah, well, thank you for taking the time, and I'm super excited for you to follow a health career and come back and be the next chief medical officer.
Yes, thank you so much.
Awesome, thanks.
Thanks.
Yeah.